Kenya continues to witness a rise in the number of cases and increased test positivity rate in previously unaffected areas. This owing to the Delta variant that is more infectious, causing increased hospitalization and deaths. 8 counties have recorded a positivity rate of above 30% in the last week, this being twice the national test positivity rate. Tonight we examine why this is a matter of national concern as counties struggle to contain the virus.
While Nairobi and Mombasa still remain the counties with the highest caseload of COVID-19, with Nairobi recording 94,244 cases and Mombasa 14,992, and having the highest attack rate of the virus, the spread is escalating in the counties that were previously unaffected. Kiambu County has recorded 122 new cases in the last 24 hours, second to Nairobi. In the past 3 days, it has recorded cases above 100. Previously, at the onset of the pandemic, Kiambu's caseload could be accounted for by the spillover from Nairobi. However, in the month of July, super spreader events, mostly being campaigns leading up to the Muguga ward and Kiambu parliamentary seat by-elections, are likely to have set the stage for further spread. The county was singled out by President Kenyatta among 8 counties that have recorded a test positivity rate of above 30% in the past week.
These are Kiambu, Nyandarua, Murang'a, Makueni, Machakos, Baringo, Meru and Nyeri. Aware that epidemiological studies and models indicate the presence within our borders of the Delta variant of COVID-19, which is more communicable and acute.
We are already overwhelmed in Tivoli, and we may not be able to take any more patients, not because they have exhausted our beds, but because we cannot cope with provision of oxygen.
Kiambu accounts for the third highest caseload in the country, 14,024. In Murang'a, the county government also shut down operations in the county headquarters with workers working from home, further ordering the closure of bars and restaurants in 2 locations in Gatanga. Murang'a has recorded 2,470 cases, 16th nationally.
COVID has now gotten into what we call community transmission. And this, when we talk about community, we mean everybody in the community, including schools.
Barrio cases, there are so many now because of the issue of COVID and other things that bring death. And so as pastors, we are trying to focus more on people who can be able to give us support.
Machakos has the 8th highest burden with 5,865 cases. Nyeri, 3,438.
We're also having the challenge of people who are being treated at home. People who basically self-medicate, by the time they come to the facility, it's too late. Or people who self-medicate at home and they even pass, they die at home.
Meru, 2,842 cases. Nyandarua, 1,532. Makueni, 1,572. And Baringo, 855, higher than 12 other counties.
COVID-19 ni kero kubwa sana na ni ugonjwa ambao huwezi kuona.
More so in the urban areas. In the last 2 weeks, we have seen the number of cases, infections going up.
While this cumulative caseload in these counties may seem lower than Nairobi's and Mombasa's, a high test positivity rate is also an indicator that there needs to be increased testing to determine the actual picture of the level of spread. The higher the test positivity rate, the higher the number of cases there are in the community. In the last 24 hours, 1,263 more people have tested positive for COVID-19. From a sample size of 8,680, the test positivity rate is 14.6%. 26 deaths, all late, have been recorded, bringing fatalities to 4,404. 2.8% of adults have been fully vaccinated. According to health experts, this current week is a crucial one, determining whether the unraveling 4th wave will peak higher than the previous peaks, even as the vaccination campaign is being upscaled. Dorcas Wangira, Citizen TV, Nairobi.